Okay. Hello, everyone, and welcome. My name is Jan Tona. I am the Occupational Therapy Program Director here at the University of Buffalo, and I am really excited to talk to you today and tell you about our program. And I have some other folks joining me, some faculty, as well as some of our wonderful students to also share information with you about our program. So, to tell you a little bit about our program, as I said, I am Dr. Jan Tona, and I am the program director. Dr. Turkesa Francis is joining us today, and she is our academic fieldwork coordinator. Not joining us today is Marianne Venetia, who is our program coordinator, but some of you may have contact with her along the way because she really helps us to make sure that any transfer credits are in place and that students are completing all of the curriculum as scheduled. And Pedro Sotelo Perrier is going to be joining us in a few minutes from our Office of Academic and Student Affairs. And I think you met Pedro in the last group room that you were in, the last Zoom room that you were in. Okay. Joining me today as well, I'm realizing that my slide is off because I do have Devang Henry and Kyle Tran from the class of 2022. Meredith Wheelock and Charlene Obang are here from the class of 2023. And from the class of 2024, I have Sue Kim and Grace Link. I want to tell you about our terrific faculty. And so we have a wide variety of backgrounds among our faculty members. Our core faculty consist of Dr. Nadine Fisher, who is actually not an occupational therapist. She's an exercise scientist, and she specializes in rheumatoid arthritis and multiple sclerosis. She teaches one of our courses in medical conditions, and she also guides students in their research projects. Dr. Turkesa Francis has a very strong background in adult physical disabilities as well as pediatrics, and a strong interest in literacy, development of literacy, and the role of occupational therapy in helping people develop literacy. Dr. Francis is with us today. She is also our academic fieldwork coordinator. Dr. Jim Lenker is a very well-known occupational therapist in the area of assistive technology, and he teaches our assistive technology course as well as a community-based course for us. Dr. Christine Linke is an occupational therapist, and she's also a certified psychiatric rehabilitation practitioner, which means that she has a lot of experience and expertise in mental health, and she teaches some of our neurologic courses, as well as mental health specialization courses. Dr. Melanie Merrill has a doctorate in occupational therapy. She is an occupational therapist with a number of years of experience, primarily in pediatrics and also with both children and adults with neurological disorders. And she teaches some of our community-based classes, underserved populations, and she also teaches our neurological rehabilitation class. Dr. Sharon Ray is very well known in the area of school-based practice. She's involved in the National American Occupational Therapy Association working group for school-based practitioners. She's helped to write the curriculum for school-based practitioners in the state of Massachusetts, and she teaches courses in school-based practice as well as OT 201, our introduction to OT. And so all students get to know her very well early on. Dr. Sue-Ann Sisto is a physical therapist, and she is the chair of our department. Dr. Sisto works with our OT students directly in that she mentors some of our student research groups. Dr. Chris Stavisky is actually joining us today, so I'll let him unmute his mic and tell you about himself for a minute.
Hi, everybody, and welcome. I'm Dr. Stavisky. I'm an occupational therapist. My background's primarily in acute care rehabilitation, and I have some outpatient care backgrounds also. I have a background in kinesiology and biomechanics, and I teach the functional anatomy course We'll be teaching the orthotics and prosthetics course, and I teach some courses or a course revolving around cognitive rehabilitation as well.
Thank you, Dr. Stavisky. And Dr. Ghazala Salim is a tenure track faculty member. She does a lot of research, and her background is in neurological rehabilitation. She's a neuroscientist. She does a lot of research on concussion and head injuries, and she's really paving the way in the area of intimate partner violence right now. She's doing a lot of research in that area, and she guides all of our students in the development of their research projects. And I am Jan Tona. I am the program director. My background is primarily in pediatrics, and I've worked at a couple different children's hospitals and in schools, and I have taught just about almost everything at some point in the curriculum, and I am there to really just help everyone along the way. So let me tell you a little bit about our program now. Our program is a 5-year accelerated BS in occupational science, MS in OT program, and it's the only BS-MS in the SUNY system. So we're unique in that way. The first 2 years when our students enter, they enter as pre-OT students, and they actually enter as public health students in the pre-OT track. And then in January of the second year, for students who enter as freshmen, if you enter as a transfer student, it might be January, when you finish or are close to finishing all of your prerequisites. The students apply to the program in January. And then in March, they find out if they were admitted to the accelerated program or not. Students who are not admitted to the accelerated program, or who may decide that they don't want to enter our accelerated program for some reason, can then complete their BS in public health. And they actually will have completed their BS in public health with all of the requirements for most OT programs. So what our students find is that they come here, they apply to the OT program at UB. If they're not able to get in, they're able to apply to one of the other SUNY programs, because the other programs require you to have a bachelor's degree before you apply. And the same is true for many other programs. They're post-baccalaureate programs. So this is a really good way to get those OT prerequisites done and complete a degree potentially in public health. And then students admitted to our BSMS program, which over 90% of the students who apply in January are admitted, will go on to our accelerated program. Where in their third year, they'll be in the professional program, and that's still undergraduate level. And then the fourth and fifth years are considered graduate level, and you'd be going through the curriculum that way. Oops. So admission to our BSMS OT Advanced program, it happens in the sophomore year. People ask, what does it take to be admitted to the program? It's a holistic admissions process. We do look at your prerequisite GPA, and we look at the mix of grades among different types of courses, if there's some that you're stronger in or weaker in, or if you're about the same overall. And there's a personal statement that's read and scored, and we're looking for people's life experiences and what they would do to help develop the AOTA vision of having an inclusive workforce to meet society's occupational needs. So we're looking at all of that and trying to make a cohort of students that have a variety of experiences to learn from and about and with each other. Our students do volunteer hours, and before COVID, that was 70 hours were required. And we may be returning to that. We actually, in 2023, we've decided that we're not going to be returning to 70 hours. We're actually doing 35 hours right now with some online observation hours. If you're entering the program in the fall of 2022, there will probably be some requirements for in-person and some online opportunities. As sites open up, as we move past COVID and places open up and are accepting volunteers, our plan is to shift back to having students do these volunteer hours in person and having them go back up to 70 hours. But right now we're at 35 hours. Some students enter the program and are offered a position in our honors college. And some students also are offered the opportunity for an assured acceptance to the program. Those students have to maintain a 3.5 grade point average in all of their prerequisite courses in order to be accepted into the program. And if they meet that requirement when they apply to the program, they're just automatically accepted. That's a small portion. It's less than half the students that we accept. So students who are not in honors college or assured acceptance have ample opportunity to be accepted into the program as well. Our OT program sequence in the third year, our students in the summer complete a course in gross anatomy and medical conditions, and Dr. Stavisky actually teaches the medical conditions course. And then in the fall and spring of the third year, they take a lot of foundational courses to really learn about the foundation of occupational therapy process, how to do task analyses, all of that sort of information. In year 4, they start learning about evaluation and intervention a little bit more. In the summer, they complete a course in group process and interpersonal skills. And they do a level 1 field work where we work very closely with a local agency, People Incorporated, and we work with the young adults in their young adult life transition program. And the students learn how to interact with adults with developmental disabilities and actually develop a project and implement a session with those young adults. In the fall, the students complete courses in medical intervention, and that's for everyone from newborn babies through old age, and physical as well as mental health and cognitive conditions, a variety of conditions. They have a level 1 field work, and Dr. Francis is going to talk to you a little bit more about that. That's about 40 hours of experiences with patients in clinics, in simulation. There's a variety of ways that we address that. And they start working on a research project. They pick from among faculty research ideas. They identify which ones are of interest to them, and then they work in a small group and they start to actually develop a proposal for research to develop new knowledge. In the spring, the students complete a home-based and educational intervention class from January through March. And then at the end of March, they head off on their first level 2 field work, which is 12 weeks at a site outside of the University of Buffalo, oftentimes outside of Buffalo itself. And then in year 5, they come back in the fall and they work in the community in places that do not currently have occupational therapy, like homeless shelters or refugee centers. And they develop occupational therapy programs there. And then in addition to that, they take an elective, and they're usually collecting data on their research at that point. And then in January, they go out on their second level 2 fieldwork placement for another 12 weeks, and then come back to finish their research and take some professional development courses to get ready to go out and interview for jobs. And they finish up their research and present their research. So I'm going to turn this over now to Dr. Francis.
Thank you, Dr. Tona. So I'm going to speak briefly about fieldwork. Dr. Tona mentioned a lot of the time during your in the curriculum where fieldwork, where you have to complete your fieldwork courses. I'm going to speak more about how it looks. And so we have 2 types of fieldwork in occupational therapy. We have a level 1, and the timing of that level 1 fieldwork varies. Some of the fieldwork are during the semester, where it's a full 16 weeks, and the others are just a 1-week placement where you go to a facility for 1 week. So that's level 1. And then level 2 is 24 weeks full-time fieldwork, and it's broken up into 12 weeks. So you do 2 12-week placements. And Dr. Tona mentioned the timing of those, and I will mention more about the months that they're actually completed. Timing in your in your curriculum, in your schedule, and I'll speak more onto the timing of them specifically in the months. So fieldwork is a great opportunity for you to get some hands-on experience from what you've learned within your coursework. And all occupational therapists are required to complete fieldwork. So this is a good opportunity for you to be able to meet that requirement, but also be able to get some hands-on experience as well. Next slide. So here's the timing of it. So the third year of this summer, Dr. Tona mentioned that you'll be doing level 1A. That's throughout the semester, and it's throughout the summer semester. I think most summer semesters are between 7 to 9 weeks, depending on the schedule itself. And you will be actually working with YALT, which is in the Buffalo community. So the placement itself will be local. I get a lot of students who ask me, will I go away for the first level 1? You won't. It'll be local. And you'll be working with your classmates in a group, and you'll be implementing an actual program within the group that you've developed over the summer. And then that course, that fieldwork, goes with our psychosocial course. So you'll be learning your psychosocial skills, how to do group interventions, how to complete interviews, all those skills. And then you'll be applying it in your fieldwork, in your level 1 fieldwork. The fourth year of your fall semester, you'll be completing level 1B. That's a second fieldwork that is throughout the semester. So it's a 16-week affiliation, basically. You're completing between 35 to 40 hours of work, working in the community, hands-on, also completing simulation through looking at videos and completing some evaluations based on the video. So it's an opportunity for you to sort of develop your skills in multiple ways. And again, that's local. And the fourth year of your spring semester, you'll be completing your level 1C. Level 1C is a 1-week affiliation. So at the end of the semester, the end of that spring semester, after you complete your finals, you go on to your level 1 placement. And I did have a couple of students that went to Las Vegas for their level 1 placement. So this one has an opportunity for you to be out of state, not just working locally with our community partners. So that's your level 1C placement. It varies. It could be school-based. It could be a medical facility. We also have non-traditional placements where you're working in the community with sometimes occupational therapists, sometimes other professionals. It varies with that placement. But again, it's 1 week and it could be out of state depending on, what's available and what sites are taking our students for that time period. The students that went to Vegas, I was definitely jealous of them. So keep your minds open to going outside for a 1-week affiliation. And then in your fifth year of your spring semester, another fieldwork that is throughout the semester. So it's 16 weeks, again, local. You're working with non-traditional placements, basically like Dr. Tona said, homeless shelters. These are facilities that provide services to individuals that would benefit from occupational therapy services, but there's not an OT on site most of the time. And they are providing programming after doing a needs assessment, and they're providing basically occupational therapy services or within our scope of practice to those folks throughout the semester. Again, with your level 1D and your level 1C and your level 1A, B, and C, you're basically implementing what you're learning within your courses within those fieldworks. So for A, it's your psychosocial and group interventions. We're mental health based as an occupational therapy practitioner. And so you learn that within your first level 1. For level 1B, you're learning more of the physical disability side of things. You're doing your medical evaluation and intervention classes. You're taking what you're learning within those courses and you're implementing it within your level 1B fieldwork. And your level 1D, you're taking what you're learning with your at-risk populations and you're implementing it in the community with those various community sites. So those are your 4 level 1s. And next slide. And then your level 2, those are your 3-month affiliations. So the timing for your level 2A is basically the last week of March, first week of April. It varies as far as the start dates. April is usually when sometimes our school-based settings will start the first week of April because during the last week of March, they're in spring break. So make sure your calendar is clear for that last week of March, first week of April until maybe the third week of June is when the affiliation ends. It's 3 months. You're basically full-time at that facility, and you're providing services to those individuals in that setting. And then your second level 2, your level 2B, is the first week of January until the third week of March. So of your fifth year. So that's your second affiliation, your second level 2s. Again, 3 months, full-time. You are there for that time period, and you're providing services for that 3-month period under the supervision of an occupational therapist during that time frame. So those are things for you to just be mindful of when you are looking at your calendars. I know a lot of students like to plan in advance. I always like to tell students, make sure you have nothing planned within that time frame for your level 2A and nothing for your level 2B, so you can be available for those placements. I get a lot of questions from students. Do I have to start and to fit like a certain type of setting for my first level 2A? You do not. I know that the curriculum was actually changed over a couple of years ago to have school-based, didactic portion of school-based be completed before students go on field work. So the options are open. So you can do school-based, you can do phys-dis, you can do acute care, you can do spinal cord injury, you can do whatever fancies your interest for your level 2s, because you've been trained in all those areas and you're perfectly equipped to provide services in whatever setting you choose for your first level 2A. So the fieldwork goals, I know I spoke about the timing, and I provided a little bit of introduction into what those different types of fieldworks do for you as a future occupational therapy practitioner. But in a nutshell, level 1 fieldwork is basically just to introduce you to the fieldwork experience, a little bit of application with what you learned, and that way you can develop an understanding of how to work with clients. And then your level 2 is more in depth. You're developing sort of your clinical application skills. It's not just observing, it's actually observing and then later on applying. By your 12th week of your affiliation, you're functioning on your own. Students by the 12th week are doing basically just touching base with their OT supervisor with what their day is going to look like. And what they're doing is a lot of documentation on their own, scheduling on their own, clinical application, like providing services on their own. And so you're basically functioning independently by your 12th week. And at least one fieldwork must focus on psychosocial practice when you're completing your fieldwork. That's it for fieldwork. I don't know if questions are asked at the end, but that's all I basically have to say regarding fieldwork within UB.
Thank you, Dr. Francis.
You're welcome.
I just wanted to take a couple minutes to talk about the OT doctorate. Some of you, you're likely aware that there are 2 ways to enter. There's really 4 ways that you can enter our field: an OT assistant with an associate's degree, an OT assistant with a bachelor's degree, an occupational therapist registered with a master's degree, an occupational therapist registered with a doctoral degree, an OTD. Many people who are occupational therapists with a master's degree are also going back to school to get a post-professional OTD. So they're going back to get that clinical doctorate. Our program is a BS-MS, so our students are entering at the master's level. That's what is required by ACOTE, and there is no requirement and no current plans to require students to enter at the doctoral level. It's been discussed, but it's not a current plan. If ACOTE did decide at some point to change to a doctoral level entry, there would probably be at least a 10-year window before that would be required. If you enter the program, whatever degree you have when you enter the profession, and get your licensure, you can continue to work with that degree forever. They'll never say to you, oh, you entered with a master's degree, now it's an entry-level doctorate, you have to get a doctorate. So if you choose to come into our program and graduate with a master's degree, you can practice with your master's degree for life. That being said, many people are asking now for an occupational therapy doctorate. We are also in the process of developing a post-professional OTD, which you may be interested in. So if you entered our OT program in the fall of 2022, for example, you would finish in 2027, and then you could continue on for 4 semesters part-time while you were practicing as an occupational therapist to get your occupational therapy doctoral degree. So it would be an additional year after you finish school, really 4 semesters. And you would be probably working full-time, but you could get the OTD then if you chose to do that post-professionally, but you would not be required to do that. So that's an option that we're working on now. We just submitted a letter of intent with the state, and we're hoping to have that up in the next couple of years. So it should be ready for you when you're done. If you're thinking about, comparing us to other programs, what makes UB great? Our OT outcomes are certainly pretty terrific. Our retention from the start of the professional program from that 3rd year to the end is about 93%. Our NBC pass rate over the last 5 years is 99%. Employment within 9 months of graduation over the past 3 years is 100%. And our tuition, especially if you're a New York State resident, is certainly far lower than any other program. New York State residents can complete the entire 5 years and end up with a bachelor's degree and a master's degree. If you are an Excelsior student for about under $48,000, a New York State resident who doesn't get Excelsior under $66,000, and non-New York State residents $150,000, and that's really much lower than most other programs. So be sure to kind of compare that. And really, what makes our program great is our students, our faculty, and our events. So I've talked to you about our faculty and our curriculum. I'd like to take a few minutes now to talk to you, to let our terrific students talk to you about their experiences. So the first person that we're going to hear from is occupational therapy 3rd year student, Sue Kim.
Hi, so I'm going to be talking about gross anatomy. And this class is held during the summer before the 3rd year of the program. So class is set up where we watch lectures before class, and the class environment is basically recall learning, where we looked at different case studies. Lab time is where we were able to experience cadaver dissection, and this was so cool to be able to experience. And we learned all of the bones, muscles, and literally everything. Overall, it's a very hard and demanding class, but it was one of the best classes I ever took at UB. And I met some of my closest friends and classmates, some that I even continued the program with. And it was an experience I'd never forget.
Thank you, Sue. And next, Grace Link is going to tell us about orthotics.
So I'll be talking about the orthotics lab. You start taking this one in the 3rd year of your spring semester. It includes a lot of, we learn about different splints and their applications. And throughout the semester, we get to experience drawing different patterns for orthoses, using different splint materials. And then we actually form the orthoses to our partner's arm. So it's very similar to simulating what we would be doing in a clinic with a client. So it's super hands-on. It's a ton of fun. This lab also allows you to kind of explore the different materials required for making a splint. So this would include like hot water pan, the heat gun, which is really awesome for making modifications, just learning through trial and error, making the splints. And then in this lab this semester, we have already completed a wrist cock-up splint, a universal cuff, finger loops, custom fit neoprene finger sleeve, and we are currently working on a resting hand orthoses, which has been very difficult, but the instructors in the labs do not expect you to be a professional whatsoever. It you really do make so many mistakes, but that's the best way to learn. And in this lab, I have learned so much already just by being under stress, learning from my mistakes and working with the instructors who are just super awesome. They're always there, super understanding, and it's definitely a very fun lab.
Thank you so much, Grace. That's terrific. I do want to point out some of our pictures were taken before COVID. Some of our pictures were taken during COVID. So you're going to see a variety of face masks, face shields, social distancing, non-social distancing throughout the presentation. So I just wanted to point that out. And next, Devay, who is a fifth year OT student, is going to talk to you about some intra-professional learning.
So for my third year, I got a chance to meet the OTA students from SUNY Erie. And I'm really happy that I was able to meet these students before the pandemic started. This was a great opportunity to meet future colleagues and understand the different responsibilities and roles OTAs and OTRs have. And what we got to do is we split into teams and worked on a case study together. And I felt it was a valuable experience to see how the two professions work together. And this also taught me about the supervision responsibilities OTRs have when collaborating with OTAs.
Great, thank you, Devay. And next, Meredith, who's a fourth year student, will tell us about Sensory Lab.
Hi, I'm Meredith. So in the spring of the third year of the program, you participate in the Sensory Lab. It's usually one of the students' favorite labs. I know it was definitely mine. It's a lot of fun because you just get to interact and kind of act like a kid. But I personally have a strong passion for working with individuals with sensory processing disorders, which is really important and addressed in this lab. So a couple examples of sensory interventions include the swings, which are pictured on the left. There are a couple different kinds, like the platform swing, which is the one right front and center. And then there's a bolster swing that's on the side. And then there's also like net swings. Other interventions include bouncing or rolling on balls, scooter boards, trampolines, tunnels, providing deep pressure, brushing, joint compressions, and sensory bins that are typically involved with the sense of touch. So they usually include a number of items that are different shapes. Sometimes it has like rice, corn, or sand, and then some even have like shaving cream just to provide different textures. So overall, this is a really fun lab, but like I said, it's really important as it allows you to understand how someone with sensory processing challenges receives different types of input within their body pathways and how to apply appropriate input to avoid discomfort and possible behavioral issues.
Terrific. Thank you so much. And now Grace is going to talk to us a little bit about assistive technology.
So again, during the spring semester of your third year, you will also be taking assistive technology with Dr. Lanker, who is super fun and very knowledgeable in this field. For the first few weeks, we've been focusing on wheelchair mobility and seating. And Dr. Lanker gives you a very hands-on experience with this section of the course. He actually brings in different wheelchair cushions, allows us to sit on them, feel them, kind of compare them to one another, which is very enriching, especially for when you're studying for exams and just getting to know the material. He also invites a few representatives from People First Mobility who bring in several different examples of wheelchairs, from manual chairs to power chairs. And actually the pictures on this slide are from a few weeks ago of my class. And it was fun. We got to reel around in the chairs and kind of play around, actually like access the bathroom with the chairs and just experience them, see what they're like, notice the difference. So that's just like very hands-on. It's very helpful in the learning experience. And then towards the middle of the semester, which we're doing now, we've been exploring environmental modifications from public building accessibility to workplace accommodations. And then the semester actually finishes up with looking at accessibility resources on devices such as our phones, our laptops, iPads, and we kind of look at keyboard and mouse alternatives, and then also other apps that help support occupational therapy just on our phones.
Great. Okay. And Devay.
So these are pictures of Albany Day. And I got a chance to attend Albany Day live 2 years ago and also virtually this year. Albany Day is an amazing experience for occupational therapy students in the 3rd and their 4th year. For many years, UB has worked with NYSOTA, and what NYSOTA is the New York State Occupational Therapy Association, as well as other schools to do Albany Day. Students in small groups schedule meetings with their New York State senators and assembly members from their home districts and discuss the most pressing issues relating to occupational therapy. And these meetings are a great opportunity for students to explore a career in policymaking or just participate in general OT advocacy. And many policymakers in Albany do not know what occupational therapy is. So this is the day that we get a chance to work on our OT elevator speech and discuss what it means to you, and you can explain it to them. Albany Day is also a way to provide insight on how to advocate for your clients, yourself, and your profession. And this year, all meetings were held virtually, but the pictures on the slide are from Albany Day 2020. Since my level 2 fieldwork was with NYSOTA, I got a chance to see the behind the scenes this year, and Dr. Tona and a few other students and I had a chance to create instructions for this year's Advocacy Week, which was sent out to schools throughout New York State.
Great, thank you. Okay, Meredith.
So Pi Theta Epsilon is a national occupational therapy honor society that we have in our program. Students in the top third of their class are eligible to be inducted and are invited to join the honor society in the fall of their 4th year. The pictures on the slide are from this year's induction ceremony.
Can I just stop you for a minute? I just have to fix that picture. I have no idea how that happened, so I'm sorry. Well, maybe you should just go ahead. Sorry about that.
Well, even though it's sideways, the picture in the middle is from this year's ceremony, so it includes the inductees from my class of 2023, the previous inductees from the class of 2022, and then just our OT faculty. In addition to the induction ceremony, we host an annual scholarly event for the OT community. I believe we have yet to do this year, but I'm very excited to see what we're going to do. This society is a wonderful opportunity for students as it allows them to network with other students and alumnus of the society. The mission is to promote research, leadership, and scholarship among OT students, which really helps students grow even more outside of the classroom and expand their knowledge and experience. As a member myself, I can say it's an honor to be a part of the society because it not only helps students, but also the entire field of OT and the public to ensure that quality healthcare is accessible. So it's a really great way to advocate for your profession and make sure that occupational therapy is the best it can be. And then in the 4th year, you really focus on interprofessional education. You'll have a couple different opportunities throughout the 4th year. You'll do a couple online forums, which maybe in person if you're in the program in a few years, hopefully. But our main collaborative event of the 4th year is the interprofessional labs with the physical therapy students and the simulation center, which is going to be talked about more in a second. But yeah, this lab is an opportunity to work with and understand the roles of both the occupational therapy and physical therapist and take on to manage a patient in an acute care setting. The lab focuses on aspects such as managing tubes during transfers, IVs, and other equipment that may be surrounding a patient and how to navigate those safely. You also learn how to approach the patient based on their needs by providing information like precautions and guidelines. Overall, this lab provides you with experience with another profession, which is so important, especially because physical therapists are professionals you most likely will work with if you become an occupational therapist. And it's very hands-on, which allows you to apply everything you've been learning in class and practice it before fieldwork. So if you are in our program one day and you take this class, definitely take advantage of this opportunity to practice skills, work cooperatively with and understand another profession while also establishing your purpose.
Great, thanks. Charlene.
Hi, so in connection with the interprofessional education that Meredith just spoke about, So in the fall of the 4th year of the program, OT and PT students have the opportunity to go down to the Jacobs School of Medicine campus to the Bailing Simulation Center. So in this opportunity, it's an interprofessional experience with, as I mentioned, PT students, and each OT student in the program is paired with a PT student from the PT program. So we work together in the simulation center that is set up like a hospital room / ICU room. So standardized patients are individuals who receive the training and they act like patients that we encounter in the hospital setting. So right before we enter the room, we get to read up about a patient. We get to review their chart and any important information, and we briefly discuss that with the PT student. And we would discuss how we would go along, how we would proceed once we get in there, and how we can work together in shared and unique roles of each of our professions. So after everything is done, there is a debriefing meeting where we meet with the debriefer and we can reflect on how we think we did, what we learned, and what we did right, and how we can improve. So overall, I did like this experience. It was an opportunity for me to get to know the role of a PT and how it can interconnect with the role of an OT as well, and how important it is to also work professionally with another health discipline and communicate efficiently while also communicating with a patient.
Great, thank you. And now you want to tell everyone about the pin ceremony?
Yes, so in the spring semester of the 4th year in the program, there will be a pinning ceremony held before students go off for their first level 2 fieldwork, which is the level 2A. So this event marks the students' transition from classroom learning to clinical-based learning. Families and friends of the students are welcome to attend and celebrate this transition and how far everyone in the program has come. For my class, since I'm currently a 4th year, it was virtual and it was held through Zoom due to COVID, but it was still a nice experience, and it was nice for everyone to come together and just celebrate this automatic this transition.
Thank you. And Kyle Tran, a 5th year student, will tell us about some of the 5th year events. Kyle?
Yeah, so this is the Aging Innovation Challenge that I did as part of my 5th year, that being the fall that just passed, so fall 2021. So the Aging Innovation Challenge is a challenge that's open to all students, actually, and not only occupational therapy students. So it's open to any kind of student that is in UB. So that can include like computer science students, engineering students, pharmacy students, nursing students, whatever you have maybe. Specifically, how this is related to our occupational therapy program is that being an occupational therapist, one of our special kind of talents and skill sets is being able to kind of help like individuals perform their activities of daily living. So activities of daily living are things such as bathing, showering, just like basic hygiene, toileting and dressing, like functional mobility. And so here in this Aging Innovation Challenge, I worked with a cohort of students in my year, and we came up with an idea to kind of support the older population that's kind of like aging in place now, that you see that's kind of a trend with aging people in general. So our idea was a loaded spring walker, and the kind of like idea or the kind of innovation behind our idea is that when you look at traditional walkers, they're very like difficult to kind of store in the trunk of a car or like store in a small storage space. So we came up with the idea to make a loaded spring walker, which is more compact and more convenient just to like bring around. And although we did not win like the whole competition, it was pretty fun because this year, or like the last year with the Aging Innovation Challenge, a group of students from my year from OT actually won the Aging Innovation Challenge. So that was really cool to see. So this is like an opportunity that you'll definitely be participating in as an OT student, because it's very applicable to our skill set, and you just like have a lot of fun, and you hopefully win like a prize money check at the end if you get first, second, or third place. So that's a little bit about that.
Thank you. Devay, would you like to talk about the research posters?
So during your time in the OT program, you will choose a research topic and work with a research advisor and your research team. This is a great opportunity to collaborate with other students and professors. My research advisor was Dr. Tona, and our research focused on adults with developmental disabilities who are often dependent on caregivers. We wanted to concentrate on siblings of adults with developmental disabilities who currently or plan to take on these responsibilities from their parents. Our group developed an 8-week program to help siblings of adults with developmental disabilities learn the role of being a caregiver. And we ran this online through the Developmental Disabilities Alliance of Western New York. We collected and analyzed the data from our study, and we will be presenting our posters this spring virtually. These are pictures from past years.
Thank you, Devay. And Kyle, you want to finish up and talk about graduation?
Yeah, so this is my last semester as a fifth-year student, and I just completed my last level 2 fieldwork. And so I'll be going back to class for like a month and a half, and I'll just be completing like the rest of my classes and presenting the research project like Devay said in the last slide. And so here you see like some of the OT caps in the previous year that were made by previous OT students. I can pretty much assure you that you probably won't see my cap in this picture because I'm not as creative, but I'm sure my classmates and my peers will be in some of these kind of pictures because they're a lot more creative than I am in that kind of area.
Thank you, Kyle. I just want to finish up by letting you all know that one of the advantages of being at a university like the University of Buffalo is that we do have a lot of interactions with people, experts from the OT and rehab community in general. We do have an endowed lectureship twice a year, once in the fall and once in the spring, called the Glenn E. Gresham Lectureship. Once again, here is our contact information if you'd like to get in touch with us. And I just want to invite you all to follow us on Facebook if you want to hear about the great things that we do. And I want to invite you to contact the Office of Academic and Student Affairs, or OASA, if you want to learn more about UBOT, how to apply, credits that may transfer in, AP courses, anything like that. So we hope to hear from you. Wishing you all the best. Please let me know if there's anything that you need from me. Again, my name is Jan Tona. I am the Occupational Therapy Program Director. My email is tona@buffalo.edu, and my phone number is 716-829-6741. Bye-bye.